So as of this morning, we have a second confirmed case. We've got the health officer's notice of that going out this morning. In fact, it may be out by now. It was a female in her 70s, and that's all that the health officer has asked me to release at this point. We have had, just got this off of Epi just minutes ago, 96 tests returned negative and 2 returned positive for Mason County to date.
So we've done 98 tests.
98 total tests. And there's still some out there in the works that we're getting them in.
Right, Craig?
If I may ask, Dave, does that number of tests include public health officials or nurses and doctors?
That's everybody.
Okay,
So
so
we haven't broken them out in that way.
Does it also include what happens in North Mason and?
All Mason
All
County.
Mason.
Okay, and now when they go into Kitsap County to take the test, does that count?
That will still come back to us, yeah.
That still comes back to us, okay.
Yeah, the results come back to the county of residence.
Okay.
So, yeah. Okay, let's see. That's my old county report. Let me go to my new county report. Okay. Actually, I think I gave you all my, no, there it is. Okay. Okay, so, Washington State, 1651, 89 deaths as of this morning.
I think it's 1896.
What's that?
1896, I think.
And that's
No,
this
it's
morning, it's 90.
Yeah, that's what I got off of,
95, yeah.
that is what I get off of DOH, and that's what I use. It's just straight off what I get off my DOH epi.
I think
That's what they put out. It's
Yeah.
a day after.
Yeah, it's
Right,
a day after,
yeah.
because
And
it's
this
online
morning
though.
was,
Yeah.
yeah,
Well,
1896,
I think it's
1996.
is it?
Yeah,
1996 with 95.
yeah.
Because
Yeah.
what I got this morning, well, actually, the DOH site was down this morning when I turned it
Yeah.
on.
What a day to crash.
Yeah, so the site crashed and then the epi also went down. They emailed me their latest epi, which again is from yesterday.
Yesterday, everything crashed, it was weird.
Yeah. I haven't been able to send any emails out from home unless I use my cell phone. So it's just been kind of crazy. State appointed a single person, which is a good idea, as a director for the response. And she started this morning. So, of course, President Trump declared yesterday PPE. We have estimated delivery of our first batch of PPE for today or early tomorrow, right? And that's everything that was asked in the first place, plus tests. And I have 2,500 tests.
It's still not popping up.
What's that?
I think I'm having issues with Wi-Fi here though.
Oh, is it our Wi-Fi?
Yeah. Are you?
Everybody's Wi-Fi's having issues because all the kids out, everybody's out
Yeah.
Wi-Fi.
Gaming.
Yeah,
Even though
exactly.
they boosted up the Wi-Fi, they're still getting slammed on it.
Mhm.
So
Yeah, well, let me connect to our,
Yeah, I just went to
Yeah,
the
so
phone,
no
I just
internet.
turned off our Wi, it is our Wi-Fi.
Yeah. So we do have PPE coming in. It's going to be delivered to Public Works because that's where we can get truckloads in, and then it will be dispersed from there. So we have the ability to offload with forklifts and things. Last 48 hours, we had a homeless person on Friday night, 6:30 in the evening, went to the shelter and was turned away because they were ill. They had a cough and a
That's
fever.
that one you were talking about, huh?
And this pointed out a problem, something I had not foreseen. What happens if someone goes to the shelter and they are ill for a reason that's not COVID, and the shelter turns them away? Now where do I put them? So we had Mason Central Fire evaluate. They took them to the hospital, and the hospital admitted them. So and kept them over the weekend because they had some other underlying problems as well. So they've kept them over the weekend. Now we'll be working on how to house this person going forward. So again, it's a problem. We've thought about COVID patients, isolation, quarantine, but what about those that are sick that aren't allowed in places? They get kind of voted off the And we had that
Which-
last
yeah.
week.
That happened.
We had a person in a nursing home that was turned away because they had been on vacation somewhere. So, so we're working those issues. The intent is to try to get something into building 10 as soon as we can. And
So how would that be staffed?
we're working that piece.
Okay.
You're putting a request out to nurses.
Right. And so a lot of it, if it's just, yes. So nurses, we're going to the medical reserve corps. The governor has waived the criteria for people out of state who are licensed to come in. So typically they have to be licensed from Washington as well. They're not required to be licensed from Washington. So we can recruit from out of the area. And Seattle is working that piece pretty hard. So they're getting lots of folks in.
Real quick, so Dave, my wife emailed Lydia
Mhm.
asking if there was any volunteer opportunities, so if you could.
There will be.
pursue on that,
Yes.
So,
Mhm.
put a nurse to work.
You gotta say,
Yeah.
she's a pro.
Yeah.
Yeah.
So, yes, there will be. So, I mean, we'll have need for staffing for medical care, administration, and then we may have to have security as well. So, there'll be three elements there.
You will.
Yeah.
Well, you know, if you have somebody that comes in.
Volunteering?
Well, question I have, do you want me to contact the security company that we're using?
Yes, if
For
we
the
get their
courthouse
contact
to
stuff.
see if they
yeah,
have staffing available
Yeah.
for security down there?
Right.
It makes sense, we're already under contract, we could just do a quick.
Is that 24/7?
It would be, if we open up that, it would be 24/7, yeah. Because we're not gonna turn them out during the day.
Two.
Probably one,
Okay.
yeah.
But
For
on
now,
shifts.
yeah.
Working shifts.
Armed or
Yeah.
unarmed?
I don't think they need to be armed,
Okay, just asking.
yeah.
I was holding my breath waiting for the
Yeah,
answer.
I mean,
At least
you
one,
know,
at least one.
if
Well, yeah.
we have
He has to sign
patients
a document.
that have mental
Oh,
health.
being a queen in one arm. Go ahead.
So if we have patients with mental health issues, we're looking at possibly using the ENT. Upstairs has rooms that had not opened yet. So we're trying to make some arrangements there. We're still working that way
And also working through the city then.
and working through the city, yeah. So yeah, the city has a piece in this.
Yeah.
Yeah.
So we're going to try to push that a little bit more. We did have a phone conference yesterday with Department of Health discussing local actions and reactions to a possible shelter in place. And it was a very, how do you put it, a robust conversation. So some jurisdictions were pushing pretty hard for shelter in place. Others, including surprisingly Pierce County, were saying that we only get incremental benefit from that, and what we need is PPE and testing. So somewhere probably in the middle, there's a way forward, and I think that John Weisman was going to take that info and talk to the governor yesterday, along with three leadership from Pierce, Snohomish, and King, and try to come up with what the next steps were. Our other piece of that was, please do not forget that rural counties, just because we don't have a lot of cases, and it's not that we don't need PPE and test kits, you know. So please make sure that we are taken care of as well, because it's just here or Garfield or Okanagan or wherever. There's still a whole other part of the state that's not those three counties.
Well, as we're starting to loosen up some of that stuff, are they gonna be loosening up at Mason General? Are we gonna get enough, are they?
They'll-
That's when we
they'll be-
started with that 25.
We have other people that are going to Lacey right now.
Well, they'll set it up, they'll still have to meet the criteria for testing. So if they show up and they're not sick, and they have no symptoms, they're gonna get, say, well, come back. We've been doing phone ICF meetings, we've done those twice now, and they're doing them, that's how we're going to do those from now on. And that's working well. So I was on, but my internet would allow me to see, but I couldn't respond, so I'm using the chat function, trying to be in conversation. It was interesting.
Same issue.
Mhm. So, we have a nurse on staff who's gonna be working solely with planning for an alternate care facility at the middle school. You know, what it's gonna take to get, if we have to set up, what does that look like? The hospital said we can have up to 2 days lead time on when they're approaching their limit on their beds. So we're working with the two to try to coordinate that, so we can get the lead to hit at the right time, that we can get the facility stood up. So she's working at it full-time. And she comes to us with experience doing a lot of that kind of work, so we just put her on this last week. Again, our needs are personnel. You know, when we have these shelters up, that's gonna be the
Should we be having that discussion now about trying to get some temporary
They-
help in
they're-
your department?
Yeah, they're coming up with plans
And
and
I'll
and
come.
requests.
And I'm coming to that, yep. So, we're requesting, I put in an order for 100 cots, linens, hygiene kits. If you have someone sick, say we do 30 cots and someone's sick, we take that cot and all that linen and stuff out until it's sanitized and bring in a whole fresh set. We're not gonna put people back in. And that gives us the ability to do a couple turns while things are being sanitized. So that's what my thinking was on that. We started working this weekend with, actually last week and then into the weekend with Chambers of Commerce to start working on the long-term plan for recovery, because that's going to be a big piece of this. And the chambers are going to lead some of that work. One of the things I need is preliminary damage assessment, so they're starting to work on that right now and give us an idea of what damage to the economy looks like. We've talked to folks from OMB who talked to their gurus at their national organization, and they're predicting, they didn't talk about first quarter, but second quarter they're talking about a 40% drop in growth domestic product, 12% in third quarter, and then returning to normal in fourth quarter. So that will be reflected in sales tax revenues, both locally and at the state level.
Good thing toilet paper's taxed.
Yeah. Let's see. Mason General still has 19 beds available. And I had, we're also tracking Kitsap and Thurston County. So who's got what in availability of beds. So that, and we keep that updated daily.
How is Kitsap County?
Harrison still had, I think they had 23 beds available, and I think there were 23 beds available in all of Thurston County. So Thurston County is running a little closer to being on the edge.
But with 265,000 people, that isn't a lot of beds.
No, it's not. So they're probably going to be getting, there's 4 hospitals that are coming in that the military's going to be bringing in. So the hospital ship is going to California. And it looks like they're going to be setting up 4 portable hospitals in Washington. And I would imagine those are probably going to go to the big population centers. So
500 beds apiece.
Yeah,
So that builds that up.
There won't be nothing around for us, we have to take people.
Mhm. Right. So going to Commissioner Trask's point, been working with Wasalfo over the weekend. There's some money coming to Wasalfo, and looking at how we break that out to the local jurisdictions. And we would be receiving, and we're going to vote on this week, around $250,000 that would go towards sheltering, alternate care facilities, all those pieces that go with that part of the response. So one of the things I would like to do is I would like to get permission today to start looking at maybe a county employee that we could hire. They could go up and work admin and help us work the administrative part of that up at the EOC. That would be very helpful.
How would we work that? Is it a temporary hire or?
Probably temporary hire.
Just
So I will get with Dawn. So if that sounds good, we'll have the money coming in, so.
Candy's over what she is. She is
Yeah.
barely holding on.
Right.
She's got so much. to
Is there
do.
any provision to have quick budget adjustments during an emergency, or is there?
You would have time to adjust his budget, because he has capacity, we're early in the year, so you
Mhm.
could adjust his budget
Yeah.
before it gets to the point where he wouldn't have money.
Right.
We might want to put that on the agenda here shortly.
So what we get, we'll probably have to go into a budget adjustment as far as additional spending, so
Yeah.
we'd have to change the bottom line.
And there could be additional adjustments that need to be made, so
Yeah.
we'll know here in the next
So
couple of months.
we can capture that in quarter 2.
Yes, in
Mhm.
June, we can capture
Yeah.
what.
Right, because it will arrive in
But
quarter 2.
250 is a big amount,
Mhm.
so I think we have to, don't want to leave you in a position where you have to choose something.
Right, so we're putting plans in place to work that money and
I was gonna say, I'm good with adding that capacity.
Okay.
I don't know if you need any more.
Yeah,
well,
He just needs to
we're
go.
kind of playing this by ear,
So
so.
would it be possible, I know some people, if we go for the shelter in, or there, people are deemed non-essential, is there a way that we can grab another person that's already employed and
So-
put them up there?
Here's the discussion, Frank. So I've got money coming in, 250,000 for response. I'd like to use some of that to bring an admin assistant up to the EOC to help us coordinate the sheltering pieces at the EOC. Can we use a county employee that might be going home as non-essential? Do we do a temporary hire?
Mhm. Now, how would we, no, we would just leave that person on,
In their current
in their current
position?
status.
Actually, you'd make them.
Yeah,
one of those
and then just
employees.
change their pay
Yeah.
Okay,
to accommodate that.
Do we need to do anything officially for him to create that position immediately?
They're approving now, he could have temporary staff.
Yeah, we could just do a temporary, it's not a new position, we have the position, you would just simply
You have the
redefine
position.
that individual. I may have to negotiate that with the unions, but I'm
Yeah.
sure that wouldn't be
yeah,
a
it's,
problem.
I don't have the position per se. This would be like an additional person we bring on.
Yeah,
to
and he
work
doesn't
with
have it in the
EOC.
budget, and he doesn't have it,
And we
So-
may or may not
so
be
to
able to
create-
use existing staff, it
Yeah.
depends on who's available.
Yeah.
so to create a position, do we need to
Yeah, we
actually
would
do it up
need,
there?
yeah, we would need something from the,
That's what I thought.
from the diocese.
So tomorrow we can.
Yeah, let's put it
Okay,
on there.
all right, we can do that.
And I got word from Pacific Security, they will get somebody for us. It'll take them about a week. If you need them that quickly,
Mhm.
and it would run about $5,900 a week, 24/7.
Should we just tell them to start preparing for that now?
What do you think, Ross?
Yeah.
Yeah, we could use, if we have to, we could use it elsewhere, right?
I'm sorry?
If we don't have something set up for that, for the housing, building 10 or whatever we decide, we could use him elsewhere temporarily, as long as he's on board, and he's ready to go.
Well, I
Yes.
think, I think we're starting to work on building 10 to get it ready.
Yeah.
So I think that person is going to be, it's not gonna be a when can we use you, it's,
Yeah, because
It's
we're
okay
gonna
to
need to
report
get
on
in
this day.
porta potties and showers and, you know.
But in security, you're not gonna be able to use them for other stuff except for security.
Right.
So the question, you know, I guess we could have them stand outside, with nothing going on, but I meant when people were there.
I think it's gonna be a busy place for a while.
Mhm.
And so regardless, even if we're just setting up, that person is still gonna be needed to keep
And I am.
people out or,
And you can use them for other things other than just strictly security. I do know that the security over at, the security at Safeway, same company,
Mhm.
does supplement their security functions.
Yeah, I was gonna say, but don't be getting us in trouble with the union, Frank.
Okay.
So you could use it for other
Okay.
items.
All right. We currently have, you see our inventory for procedure masks. And that will be supplemented tomorrow by a lot. So what did we order? We ordered just in cases in case there was something.
Yeah.
And so it was masks and gowns and gloves.
3,000, and I actually boosted it up when I talked to them yesterday on the phone. They reconsolidated into one order instead of 4 separate orders, and I added a little more to them. Excuse me, so we got gloves, gowns, masks coming, paper towels, disinfectant, the squirty stuff, you know, the alcohol-based hand sanitizers, all that stuff is coming. Now, I don't know exactly where they're getting it from, but all I do know is in their email to us, there was no cost. We're not expecting, don't expect an invoice or anything for it.
I wonder if it's that stuff from the
Stockpile,
army, maybe
maybe, or-
stockpile.
Yeah, that's what I was thinking,
Security
national
stockpile,
stockpile,
yeah.
maybe, yeah.
I think Shelton Dental also needs a call out.
Yeah.
Yes, they donated-
donated 1,000 masks.
No, they're 3,600.
3,600, yeah.
That's incredible.
Yeah.
$1,000 worth
Just
of
amazing.
masks. We
Yeah.
wrote them a thing so they can take it off as a hand receipt from them.
That's crazy, good.
That was great on their part.
Yeah. We're working on messaging in Spanish. We've got the messages, we just need to get those out. We're working on signs for schools and parks. We had a case over the weekend where one of the, I think it's school ground, right, was being used for a soccer game.
Yep.
So
Yeah.
we're gonna be working on that as well. And we're talking about doing videos for those who don't read. So we'll be working on that as well.
Actually,
That's a good point, yeah.
yeah, I hadn't thought about this, but we have quite a few.
Yeah. So we're doing Building 10 and the Alternative Treatment Center. We're working on both of those now. Maple Lane was pointed out as being available to us, but that's cleared down.
Well, I'm gonna call again, because when
Yeah.
I called there before, nobody seemed to know anything about it. I'm like, really? Cause they closed down the one up north. It was supposed to be for the entire west side of the state was going to use Maple Glen as a, if an overflow for either homeless or whatever that are in this system for quarantine or isolate. And nobody seemed to know it. Well, the person I talked to was a duty officer. He knew nothing about it, so I'm gonna go
And we don't
today
have
and call him.
transportation either. So.
Yeah, that's a distance, I mean, it's Grand Island. It's a little distance from here to do that. And who would be doing the transports? You know, so.
So, moving on, seasonal homes. We're probably gonna see those being occupied as people leave Seattle to come to someplace that's got more
And
distance.
Mike's getting beat up on that one, I'm sure you are too, because the Cushman areas.
So the
Yeah.
people will be occupying those homes and.
But they're allowed to, there's nothing
No.
that the commission.
So I don't know about that, other counties and cities have restricted VRBO and rental
But
access.
these are their owned homes.
Oh, okay, I got
But
it.
at the
Yeah.
same time though, I don't wanna leave what he just said though.
Right.
Because, yeah, we can't stop them at home, but we could do something, and I would like to, at least temporarily on that.
Right.
Because you're getting people.
In California, they have restricted it in certain
Counties
counties.
in Oregon, and then I think,
Sonoma
I-
County has restricted it.
I'd like to hit that
Kid
ASAP.
Tax was talking about it because what they're seeing is influx of RVs coming over the hill
Yeah,
from Seattle.
well, I can tell you that that's happening a lot too, but those VRBOs are also booking out. And we can have an impact there, we may not be able to have an impact on the other, but we can impact that.
Okay,
yeah. So, and I think Long Beach has restricted theirs.
Westport did.
Westport
closed down.
Yeah,
Yeah.
copy and paste, let's get that,
For tomorrow?
I would like to see it tomorrow.
Yeah.
It'd be one thing that we can do to help these.
Commissioner, can you work that?
Good call, Commissioner, that's.
I'll try and find and email you an example.
But mostly all small communities, they're just being kind of, for lack of a better term, inundated with
Yeah.
the resources and stuff, they're just, they don't have the capacity
Yeah.
to service them. So
Well, I
it's
think
more
that
of
even, as part of even touching on the resources, I think that there was people were standing outside Walmart to go in to get toilet paper, and they came from Thurston County.
Right.
And so
Right.
it was
Yeah.
quite the
Well,
scene.
the same thing at Safeway and QFC this last weekend, there was a lot of people, they didn't come with RVs, they just were coming here to get supplies because,
They couldn't get it.
yeah, they couldn't get it, the same thing for people from Kitsap County now.
Yeah.
Well, these guys were going to sell it again.
Oh, man,
Yeah.
There's a lot of places that are offering discounts if you book with them.
yeah.
Mhm.
Now,
Wow.
I think that the stores are doing what they're doing, is there anything that we can do to help, put any type of regulation to stop this? Just to let you guys know, it is starting to come back,
Yeah.
some of the stuff,
Mhm.
but one blip,
And that's-
one thing, and it'll happen again. Is there anything that we can do?
I think a lot of it just has to be our messaging, because I
Right.
don't think that we can't control what private businesses are doing.
And some places are already putting on limits.
Right, a
Yeah.
lot of them have put on
Yes,
limits
Costco
already.
has limits,
Yeah.
Safeway has limits, Walmart has limits. So I think, and they're also putting up other precautions too, other procedures.
Right.
So I think all we can do is support them in whatever decisions they're making.
I mean, Walmart was doing some good things when I was there the other day in that as you got a cart, they kind of told you from a distance, go through over here, wipe the cart down. They had wipes and stuff, you would wipe the carts down and then into the store. So I appreciated seeing that, so I thought.
But yesterday they had no wipes.
Yeah, I was gonna say they're out
They
of
Oh.
weren't
limits.
doing anything.
Okay,
So, yeah, it lasted, I guess, as
then-
long as it was bad stuff.
then there's that. I did work with Aaron from.
Actually, can we help, can you order anything? Can we get wipes for them? Well, that, if you think about it, that's a bottleneck. That makes sense, you know, to be able to have wipes for them somehow.
Yeah.
I'm betting their supply chain is faster than ours.
I would think, but if they don't have them,
They had wipes at the checkout,
Yeah.
but they did not at the door.
Yeah, they didn't have them on the carts,
Right.
because I saw
But they
that
had them
too.
at the checkout, so they have a supply somewhere.
Right.
Might be not as much as they like, but I was disappointed that there was no wiping down of carts when we walked
That's,
in.
yeah, that's where it's gonna spread.
Yeah.
Yeah. I think a lot of it
They did
is
bleach water.
personal accountability too.
Yeah.
You know, take your hand sanitizer and use it every time you can. Wash your hands a lot.
But again, a lot of people can't find hand sanitizer to buy to have, literally.
Yeah.
I know we told them to make it, but, you know, some just can't do that.
Yeah.
Yeah.
Well, that took a while for me to get around.
Yeah.
So, the other thing is if we could maybe start providing some signage on, for some of these businesses, like especially the grocery, I know Pittsburgh got hammered over the weekend, just how to maintain social distancing and just some informational.
We
Okay.
brought that up today at the briefing,
Yeah.
and that was
Yeah.
gonna be done. That's one of the two different signs we're looking at.
Yeah.
We're looking
Yeah,
at
we're looking
another one, it's a short, sweet one about something being closed for a reason, you know, to help curb the COVID-19 virus. That's why this is closed in English and in Spanish. And put those posted in places.
We're asking the schools to do that.
What about the places where they are, like the bars that are opening up at night?
Okay.
Well,
That's, several,
and I
For
had
food
heard
or
those.
for both,
drinks?
yeah.
Yeah. And
I contacted you on one of them. when
Right,
they
I
were-
got with that one. That one quit.
They had a whole big thing going, they were the only game in town.
Yeah.
Oh, yeah.
It's like a speakeasy.
Yeah. I'll get with our food folks and find out what's going on.
Maybe even just someplace where we can, because I hate to bother you all the time.
Is the barbecue place still going?
Yes?
Oh, thank God, okay.
Yeah.
It'll be heading up there, so.
There was some question, I guess, about their seating arrangements, because
Yeah.
they're outside and stuff like
Yeah.
that. But I
Still
guess,
have to
Still
social,
have to-
you still
yeah.
have to distance
Yeah.
yourself.
well,
And
and
they could do it probably
Yeah.
up there in that outside
and
one.
they were distanced themselves, they
But,
just,
Yeah,
they took all the foods and all the things that people used to get for their sauces.
yeah.
That's all gone off the tables,
Yeah.
they don't allow any of that
Good
anymore.
idea.
Good.
Yeah.
Yep.
I
Did
love that
start
place.
working with
It's
Erin
so
from
good.
Olympia Master Builders yesterday. We conversed several times. And she provided some documents, and Christopher and I are going through those. I think most things they're suggesting, we already do. So I think it's kind of shock and blast to all the folks they work with, not just us, so other counties as well.
I think Mason County needs a shout out too, because we've heard from several other people that Mason County's ahead of the game, because we started early and started preparing, so I think our people in Mason County rock.
Yeah. Oh, yeah.
Except for that
I mean-
one guy that just
Well,
hates you with everything he's got.
And then I've got, Lydia was up at 4:15 this morning and let me sleep. I really appreciate that, because I was up till 11 last night working other things, so.
Well, and
She's
just,
really
just so
rock,
you
so.
know, I got a text message from the person in a long argument that was going on, and even he said himself, because like I'm saying, that's not what he said. The claim is, he says, it's just the flu, that's not what he did. What happened is, and the guy sent the text, I asked him over and over again, is it the flu, is it the flu? And he said yes. Like, there's a big difference between him sitting up there saying, it's just the flu, folks, and him just answering you and saying, it's the flu, you know?
So actually they coined new terms. So we've been talking about influenza-like illness, and we've used that for years. Well, now they're using the term corona-like illness.
Yeah.
Okay, so we're just kind of adjusting our mindset around that.
Yeah. But
and-
you didn't sit there in front of everybody and just tell them, hey guys, don't worry, it's just the flu. That's not what happened.
No. So,
Dave, are you still on community development?
oh, Christopher, so for our own group, so I put out an email to our folks, public health, you are essential in a public health emergency, plan on.
Tag your.
You know, so I tell them expect long hours and possibly working weekends. So they were brought into the loop. Christopher, would you like to brief on what we're doing in planning and
So I
building?
did want to bring the commissioners up to speed with Kel and I work as a team for community development. and the essential priorities in our department for housing, supply and demand, keeping things moving forward for economic recovery, because this is projected to be at least 8 months after this event. So between now and then, we implemented, as soon as you guys got the telework policy out, we did situational telework for staff that's already in a high-risk category. We already got folks that are doing inspections via digital. We're trying to use as much means as necessary to keep us moving forward with our clientele, so we
I think
don't
that's
stop.
critical.
So,
Awesome.
yeah, unfortunately, it's.
So we're taking armloads of plans home and
I
doing
was gonna
kind
say,
of.
just so you know, your department, your building department is probably the least complained about one right now from people that are calling in.
Well, with that being
shift,
said,
but-
you know,
You know, they
we
get
have
it,
the
they
doors
feel like
shut
they're still
down.
moving.
People are coming in through the via glass shield from the old, because we're in the old building that has that. So that works well for at least helping those that are walk-in. We're solely appointment-based for submittals as well as for pickups. We're doing those, we're rotating them throughout the week, so it's not a full bombardment. Limit those who are coming in to do that. And it's, so far it's working okay until things change. But try to keep people moving forward, keep working while we can, until governor or the feds say it.
At a UPS store, they've actually put hard, like plastic wrap
Plastic.
on, no, it's a hard plastic, and like, you might do it, but it's completely see-through, and they've got it going all the way down the door, so you can do essential mail services and stuff still with them for UPS. They keep a table this far away, so you can go like this and get it through, and nobody,
Yeah, and
the ingeniousness of people are,
and just one last thing, is that we were already at a skeleton crew, so anything that we can keep our staff working is a benefit, but you know, it's, a lot of people at this time, they're very cautious, and fortunately, a lot of those who already had appointments just for like pre-app appointments, they're finding ways. We hadn't had the group video up and going. We had a contractor actually set it up and did it for us. It was a real good learning curve prior to us getting our Zoom meetings through the county, so it's working. And that's mostly all of them set up for today, are all Zoom meetings.
Good.
So, yeah, people have plans in their hands, so if they do a shelter in place and builders aren't working, they'll have stuff in their hands. As soon as it comes off, away we go. There
it's an
will be
opportunity
a
to get
lag.
caught up in things.
Yeah. Ross, is there anything you wanna?
This is working really good. One thing I gotta say, if you come to our meetings and come to or else go on to Zoom when we have our Zooms, I gotta say, this is probably the best group I've ever worked with, bar none,
Yeah.
really. People are, you mention something, you get a hand saying, I'll take it, I'll do that. It's been phenomenal. It really has been. It's been long hours, but it's been phenomenal by trying to get stuff done and accomplished with this group. Everybody has got skin in the game of it. We completed all of our ESF functions that are involved in this. All people have come up and said, yep, we'll do this, we'll do that, we'll get it rolling. And I gotta say, it's been doing really well. We do have our succession plan, as of the 6th. Oh, he was just here. Ryan will be taking over as the incident commander, and I will be his deputy commander. Right now, he's my deputy. We're gonna switch every 2 weeks. But we're still gonna be there during all of this, because we still have other things that we do while and helping each other out. And I believe you're doing that with Chris. They'll be doing the switch offs too. We did that with all of our functions so that nobody gets burnt out during this phase. And I asked the ESFs to do that also from there, so they have somebody else that's up and running that can take over in case the real world kind of comes into play and stuff for us. But it's been phenomenal, and we do have everything set on certain schedules. Schedules are working out pretty well, and paperwork's going very well. So we're doing everything a week at a time right now. So if you like that 203 I sent out for everybody, the organizational charts, those are good for a week. And we'll do, every Monday, one of those will come out. So I'll make sure you guys get all those, and you'll know who's doing what and what phase they're in.
Also, could you, I get these at the meetings, the account reports. So could you also include these guys? And
Love
we'll
to.
just email them out?
Yeah, I didn't have one of those this morning yet to send that with it, or else I would have piled it all. Yeah, we're trying to put that out, and your guys are all on the JIC list now, the Joint Information Center list. So you should be getting everything that we put out, you guys should be getting that. I'm sorry you weren't on that list, I think that was part of our, if you don't have the
As long as you're
information, how
talking,
can you
you tell
put
me
it
that
out,
helps.
you know?
Yep.
Yeah,
I don't think I was either, to be honest
So-
with you.
yeah,
These, I try to have done by 1700 daily for the next morning. So
Be
I
able to get
shoot
those.
those out as soon as I get them.
and Norma Brock, I don't know if you guys know Norma or not, she
She's
works with Central
amazing.
Mason. Central Mason Fire and EMA, a godsend for us here. She's actually part of an IMT team, so is Casey Whitehouse, who is our liaison chief, who's in charge of all the ESF folks and getting them running. Thank God we got those guys. I think that's one of the reasons why we're so advanced.
I think Casey will also he'll be transitioning out
Right.
because fire season is coming,
Yeah,
and he's the fire guy.
yeah.
And so
And
he'll be-
Bo,
Bo, yeah.
I had
Okay.
Bakken, sorry, I was called Boken. The kid, Bo the kid. Bo,
He looks like a kid, but he's actually been around a long
I
time.
know, I was shocked.
I know he looks like
Yeah.
a kid.
It's like Son of Dave we've been having some fun with some of this here. I didn't get to introduce to Dr. Stein, and then he was here at a thing, and I thought he was Dave's son. I'm like, oh, is that your son? That's son of Dave's son? And he's like, yeah, that's Dr. Stein. I'm like, ooh, boy, I felt like, about this big.
So like a penny.
Now he has taken on Son of Dave is his new nickname for him, so, yeah. Yeah, Son of Dave. But really good group. We are trying to keep everything, we're doing a lot of the contingency planning because we know how things keep changing. And for a while there, it was changing 2-3 times a day from Department of Health and also the governor's office. And I'm really interested to see what he does today. I really hope he gives some good guidance to go along with if he does make this shelter in place order come out. I really do hope he gives good guidance with it because there's a lot of questions around that.
Is the governor speaking today? Do we have a?
He was supposed to speak yesterday too, and we had noon and then 4:30 is what it said on the TVW site, and
I'm not gonna say who, but somebody said, I got good news and I got bad news, and after the end of the conversation, I asked what the bad news was, and they said the governor's gonna be speaking at 4:30.
yeah,
That was the,
Well, that was part of our pushback to
yeah.
DOH over the weekend was, you get us prepped for things and then they don't happen. And that creates a lot of anxiety amongst, the health jurisdictions. So we plan on what you put out.
Yeah.
And when we get ambiguous things from DOH, it doesn't help us.
Yeah.
So, and some places are making it up as they go,
Which doesn't help.
either. So we had a couple of those administrators yesterday were talking about that, and they're frustrated. Especially those along the Oregon border, because they're having to coordinate not only their Washington side,
Yeah.
but the Oregon side.
Right. Jumping boat.
I had a question that came up. Parks has closed.
Yes.
We have a concessionaire who is
that was interesting.
up at the park and asked if they can come down to the Building 10 parking lot. You're making plans for Building 10. I had put to the board a question of whether or not that person can use that parking lot. But if you have plans for that parking lot, does it make sense for a concessionaire to even consider
Actually,
coming
isn't it
down there
better?
to use that?
If you put that person all the way on the corner, isn't it better? Because you're gonna have a lot of people,
A lot of
maybe,
people.
and be able to have.
He has a business license that he's required to have for the city of Shelton. He already has insurance as it relates for being a concessionaire on county property. So we've got licensing
I
and
guess I'm not
insurance
seeing a
covered.
problem right up front with it.
I think my concern is, are we putting one person over other people? You know what I mean?
We've
Yeah.
already,
One business
we
over
already
another
did
business.
we already contracted
Yeah, we
with
did a
them.
bidding,
Contracted with
we did a bidding process
Yeah,
with them.
that was a bidding process for that one. Yeah.
It was actually a bidding
The
process.
Sand Hill one was
That's
not
fine,
as
they
much
remember.
because that went back to
Yeah.
the little league
Yeah,
organization.
but that one was bidded,
Yeah.
bid.
Alrighty.
Yeah.
Back in
So-
2019.
Can I give them the okay?
I think so, yeah.
But we,
Well,
And I'm looking for the board.
so initially, I didn't really have a concern with it, I think it's fine. But does it make sense if we're gonna be using that as isolation thing to, I mean, how, I
To
mean,
have more people coming in.
yeah, I don't know, I mean,
Well,
that,
they
that'd
won't
be
be
my
coming
only,
in the building,
yeah,
because the people for isolation are supposed to, like, stay inside the building,
Yeah.
you know, is what you're looking for,
Well,
but
what about-
not to
what about
roam
the-
around as much.
The Bank One parking lot.
We don't know.
That's not ours, so.
Yeah.
Yeah.
This
But I
person
mean,
bid to
If
be on
we're,
the
if we're
fire department.
isolating, that would be an option for him to maybe park there. I don't
Except
know.
for
Yeah.
we don't own it, we can't.
Well,
do that.
and the people at Building 10, we're gonna be feeding through a contract. So that's not gonna be an advantage to him because,
Except for the people that are working. Or are you gonna feed them also?
let me work that.
so maybe we say, okay, for now, and then when we fire up building 10, I mean, probably.
Yeah.
But the
Those
building,
would be
that may be an
flex
issue.
Depending on.
I will do that.
Because we might need the parking
Yeah.
lots as well.
Yeah,
And what
because
if-
we're not gonna bring in porta potties and shower trailer and some other, you
Right.
know, logistical pieces.
Right, yeah, so the parking lot is going to be used not by the county with
Right.
other, because the shower trailer is
Services.
big, the other,
Yeah.
the
Well,
porta
it's,
potty.
hopefully, we're looking at a two-bay only shower to start with, because that's, the other ones they want,
Yeah.
way too much money.
Yeah.
You can rent them, and then you have to also have a bladder, and then you also have to,
No,
yeah, somebody come there and take the water out of the bladder, because you can't drop it right into the sewer system there. If we could do that, it would be pretty simple,
yeah.
but you can't,
So,
yeah.
Still that water, you know, the droplets, that's off
Yeah.
their body.
well, we're not talking about COVID people. We're talking about people who are ill from other things who aren't allowed in the shelters. If they are ill with COVID,
We
we're
don't-
going to put that up at the middle school.
But we
with
don't
a-
know they have COVID for a while.
He did.
Just to say.
Yeah.
Briefing with the board of county commissioners, give you a yell right back.
So, seems like there's maybe a
Thank
couple
you,
of
brother.
questions that
Okay.
need to be
Right back.
hammered out on
Right.
this, but
Yeah.
maybe in the interim, he
Yeah,
can,
and the under, and look at other properties perhaps, if they're gonna allow, because I'm assuming they're not gonna expect a whole bunch of walk-up traffic there, they're gonna be doing deliveries or drive-up or whatever.
Predominantly driving.
Yeah, we have another piece of property that's got a good parking lot over by the old Catholic rectory.
Yep.
Just,
Yep.
if that becomes necessary, just
That might be
think
a good one, yeah.
outside the box.
for the parking lot at Mel.
Yeah,
Yeah,
Mhm,
yeah,
mhm.
that one would be
Yeah.
drive-up service.
Yeah.
Oh, yeah, that'd be good there.
If you get that one, if they
Yeah,
get that one,
actually,
make sure they say thank you.
I'll,
That'd be huge.
I'll
He
mention
has
that.
really good food too, that's another one that's got good food.
Was this at Mendoza?
Mhm. Yeah, he's got good food.
Small truck.
okay.
I still like the barbecue place better up in Belfast,
That's pretty good.
obviously.
So, are there any questions?
Oh, millions.
I know.
But I,
You've
and I
heard
also,
and answered a lot of my.
I also like to thank Sharon for coming and being at the meetings. I know all three of you can't because of the, you know,
OPM.
Yeah.
you're not allowed to be together, some kind of court order against each other or something. But it's been really nice having it, because we can turn to her for a good, hey, is this good? And, you know, getting the heads up on stuff right away to get people rolling. Because a lot of times, some of this stuff comes into us and we have to move pretty quick on it. And I really appreciate you being there to help us out with it.
The nursing crew has been doing a great job of running this stuff down and making sure that they're getting the real facts, you know. Because we get a ton of reports every day, and they're false reports. So, and we're trying to work with the sheriff's office because they're the ones who interact with those the most,
Yeah.
so.
Yeah. It's been good. It's been a very, very good group to get together. Very good group.